Due to family history of breast cancer, I was able to receive preventative care for breast cancer starting at age 30. Not being able to have that prevention early is really a scary thought. I already have to take a day off of work. I already have to find childcare. I already have to deal with transportation. If you add cost on top of that, I really feel like it becomes truly prohibitive, which is criminal.
As a caregiver for my wife who's been through cancer twice, it's very important that when she's had her preventative screenings, we've been able to catch everything before it gets worse.
I have been living with HIV for 8 years, and if it wasn't for preventive care, screening, and testing, I would probably not be here.
I got a colonoscopy at the urging of my doctor. That colonoscopy would have cost me $4,000 out of pocket. This is serious stuff.
My understanding of the Braidwood case is that preventive healthcare is on the line.
It would gut access to preventative care. For many of us, it would have to skip out on therapy, cut back on food. There would be a lot of cutting corners that would probably put us more at risk.
Popularly known as the Braidwood case, it is an attack on preventive health care coverage for 150 million Americans.
I typically will screen people for a variety of things. Screening for high blood pressure, for diabetes, domestic abuse.
Screenings for HIV, having access to PrEP.
When they're going after PrEP, they're going after us. They're going after the LGBT community.
I really think that it's going to be an insurmountable barrier for a lot of people. No one wants to lose access to their PCP or their preventative care.
Even the cost of transportation to get to my office, to get a screening, can be prohibitive for many patients.
The people that we're talking about here are the people on Medicaid, Medicare. For them to have to suddenly pay $20, they're not going to do it.
Taking coverage away from preventive services would have devastating consequences. We are going to be left in a society where wealthy people can do all they want to stay healthy, and the rest of us will not benefit from some of the miracles of modern medicine.
We'll see increases in suicides. We'll see increases in overdoses. We'll see increases in violent incidents, on the street. The minute these funds are cut, we are going to see a radical shift.
What we could see is 150 million Americans starting to see that they're getting the word no more from their insurance companies.
There are people in your community, and if they're not all wealthy, it's going to affect them.
I would see that we are going to have way less volume in terms of people coming in the door, especially for people with private insurance, if there is cost sharing for preventative visits. I would expect to see a big drop off in people under the age of 50 accessing healthcare.
Preventative care specifically is a natural right for everyone.
And it's unacceptable to attack the most vulnerable people in our society.
This is about science, and who has the right to take advantage of that?
We need to pull together as a community right now more than ever.
Period, good night.